I have a lipoma on my back near my spine. You can pull the lipoma away and put fingers underneath. Wow. Would I need a scan before you can offer removal? This is a hard one. We often get patients. What we ask you to do, going back to the earlier point that it can be variable, kind of how big a birthmark or a lipoma or a lesion, if you like, is. So it can be difficult to advise you. What we do, and something that I feel is, I guess it's not unique, but it's something that we're kind of pushing as a thing at the clinic, is to ask you to send us a photo on WhatsApp first. So if you send us a photo on WhatsApp first, by first, I mean before you even come to clinic. So don't charge you or anything like that. Just send us a photo on WhatsApp, and we can give you an idea from there. And sometimes we'll say, look, yeah, that's going to cost that much. Yeah, that's going to need a scan. That's not going to need a scan. That's going to be fine. But often we won't be able to give you 100% based on the photo. We kind of have to see you. We have to examine you. And this is one of those. So lumps on the back, especially central over the spine, could be several things. So you might be thinking, is it something else? But sometimes we can tell it's, for instance, a cyst in the skin. You can tell it's a cyst in the skin, and particularly if it's not so big. And you might say, well, that's okay. I can tell what that is, and I'm happy to remove it, without having any imaging of what it is and whether it's potentially connected to anything from deeper down. So this is one of those ones where, if you can send us a photo, that'd be helpful. And I know lipomas are often not visible on photos, so if you can take us a photo and perhaps circle around where it is, that will be helpful and give us an idea of scale. So don't take the photos too close up, or if you do take a photo close up, take one close up and far away, so we can just get an idea what part of the body. Often we don't even know what part of the body it is. You say your spine, it could be over your neck, it could be over your bum, it could be anywhere. So so photo is really helpful. I guess size will be important. If it's big, they'd be more likely to be concerned about needing a scan. If it's small, less likely. But ultimately, without seeing a photo of this, my general advice on this one would be, if you don't mind, we'd probably ask you to come to clinic and we'd see you. If you want, you might want to book a see and treat appointment. But we would reserve the right to say to you, look, I think I'm not really comfortable removing that based on the history and examination that I've ascertained here in the clinic, and I think it'd be better if you got a scan, which we can help you arrange beforehand. So I can't really say whether it is that or not, it's one that we'd have to probably say to you, we might do it, because there's some areas where you kind of think there's several things. This could be the neck, lumps in the neck, as I say, lumps over the spine. Other areas you're kind of a bit more certain that there's not a lot going on. There's not a lot of other things it could be. So you'd be less concerned. The forehead, for instance, there's just got skin and bone there. There's not many things it could be. Things on the arm and what have you. You're often thinking, well, yeah, I've got an idea what that is. But over the spine, there's certain areas like here and here you kind of worry, because there's things called dermoid cysts. There's certain particular areas that you would be concerned. So it's something that's kind of worth a discussion first, which is, I guess, what we're doing. We're discussing it, aren't we? So that's one of those areas where I think you'd want to have we want to leave it open as to whether we need a scan for that one or not. But that's the whole point about this, the WhatsApp sending us photos, so we kind of avoid too many of those situations where you come perhaps for a see and treat all revved up to have it done on the day, and then suddenly we tell you something, or you find something out on the day and you think, well, I don't want to have it done now, so we try and get things and try and be as transparent as we can about costs and what's involved and stuff before you come to clinic, to save you a journey and to save us a missed appointment sort of thing. Not a missed appointment, but an appointment where we blocked out a see and treat where you're not having it done. So we try and avoid that as well by giving you as much information before you come, so you can be sure that you want it done. But even so, we always say to people, if there's any doubt and you're not sure, there's no problem at all if you want to go and have a think about it. If you do book a see and treat, we try and be quite relaxed in that regard, because it is a big deal having these sorts of